Hey there, I'm Professor McBride, labor nurse, OB instructor, and your guide to everything OB. Let's get to it. Today we are going to review fetal heart rate variability and reactive and reassuring fetal heart tracings. To start to understand variability, what we need to think about is what variability is. And variability is the fluctuations in the fetal heart rate around the baseline. And these are caused by the give and take of the sympathetic and the parasympathetic nervous system in a well-oxygenated, neurologically intact fetus. So if we have these variations between 6 and 25 beats around the baseline, this is considered a reassuring finding. So let's look at an example. So in this tracing, the top graph is the fetal heart tracing. The bottom part of the graph are contractions. For our purpose, we're going to be looking at the top graph, okay? On the top graph, you can see numbers. So like here is 120, and then everything going up is going to be 10 beats. So these are beats per minute. So if this is 120, this is 130 is next, 140, 150, 160, 170, 180. So we're going to look first at the baseline. Okay, the baseline is where the heart rate is hanging out most of the time. All right, and we really would like the baseline to be within the normal range for a fetus, which is between 110 and 160 beats per minute. All right, so here's our baseline. And then we're going to look at these variations or these irregular changes in amplitude, and it makes your line squiggly. So you can see that when you see the line squiggling above and below the baseline, this is variability. And if it's between 6 and 25 beats around the baseline, this is what we call moderate variability. Moderate variability is a reassuring finding, and it is the desired variability that we would like to see. Okay, so since each of these boxes going up and down are 10 beats each, you can easily see where these variations in amplitude do meet the criteria of being between 6 and 25 beats around the baseline. Minimal variability is going to be less than 5 beats of an amplitude change. So you can look at this tracing here and you can see that you can easily see this baseline and it's at about 120. And you can see that these variations are not as pronounced, that those amplitude variations are less than 5 beats around the baseline. This is minimal variability. Minimal variability is not a reassuring pattern. Okay, but it also may not be concerning. There's a few things that can cause minimal variability. Your baby might be sleeping. If the fetus is sleeping, babies can sleep for 30 to 45 minutes, and you will see minimal variability for 30 to 45 minutes, and then it'll shift back to moderate when the baby wakes up. Okay, it also could be that my baby is sedated. If we are giving mom narcotics for pain, if she's on medications that have a sedative effect for her, it crosses the placenta and can sedate the baby. So we could have a baby that is sedated. We could, though, also have a baby that is hypoxic. When babies become hypoxic, their variability decreases. So we think about, for minimal variability, we think about the 3 S's: sleeping, sedated, or sick. And I don't know. So I might give it half an hour. If I'm not seeing late decelerations, which we discussed in another video, maybe the baby's asleep and I'll give it some time. Okay, also, if I know that mom is receiving medications that have a sedative effect on mom, it can also have a sedative effect on baby. But if I have a tracing that is showing minimal variability for extended period of time, I'm concerned then that the baby could be hypoxic. For accelerations are not related to variability. This is a separate thing. Accelerations are an abrupt increase in the fetal heart rate. Okay, so if we think about where our baseline is, Our fetal heart rate needs to, in order to meet criteria for an acceleration, if the baby is greater than 32 weeks gestation, our increase needs to go up by at least 15 beats. And so if this is our baseline and each of these boxes going up are 10 beats, each of the boxes going across are 10 seconds. So if we have an increase here from the baseline, 10, 20, 30 beats, and then it's lasting from the baseline 10, 20, 30, 40, 50 seconds. That's more than 15 beats of an increase, and it's more than 15 seconds. So this is an acceleration. Okay, this one increases by 30 beats and lasts for 50 seconds. This one increases by 40 beats and lasts for 80 seconds. This is also an acceleration. So is this one. So any of these greater than 15 by 15, if the baby is greater than 32 weeks gestation, this counts as an acceleration. If we are doing what's called a non-stress test, where we are just watching the fetal tracing for 20 minutes, we're looking for moderate variability. We're looking for at least 2 accelerations in a 20-minute tracing, and then that would be considered reactive. Okay. If we have a baby that's less than 32 weeks, then the criteria for this is going to be 10 beats by 10 seconds. All right. So for this tracing right here, we have moderate variability because here's our baseline and we have changes in amplitude more than between 6 and 25, more than 6 beats around the baseline. So we have moderate variability and we have at least 2 accelerations. So this is reassuring that our baby is well oxygenated, and this is considered reactive. So reactive and reassuring. A reactive and reassuring fetal heart tracing must contain the following: normal baseline, between 110 and 160 beats per minute, moderate variability, at least 2 accelerations if the baby is greater than 32 weeks gestation, and no decelerations. That is a reactive and reassuring tracing. Thanks for watching. Be sure to subscribe, like, and share for new videos every week about everything OB. See you soon.